Hi, my name is Kristen. I am an MSW student here at Ohio State. I was asked by OWEP to speak on harm reduction and just harm reduction models and methods and things like that. So harm reduction kind of acknowledges the concept that we really need to meet our clients where they're at. And a lot of these people, when they leave treatment or they leave an inpatient setting, they go back out into their communities, they go back out into their homes, and they're exposed to an overwhelming number of triggers that can sometimes be challenging to maintain sobriety. So the idea with harm reduction is acknowledging that relapse does happen. It's something that's probably always, going to be a part of addiction, and always has been. But harm reduction basically provides people a safer method for use. So one of the more popular ones is the Narcan distribution through Project Dawn. There is a project with my fire department I am currently working on to boost the availability of Narcan in our communities. I have 15 years as an EMT, and I can tell you that having this access to Narcan in our communities is huge. Irreversible brain damage begins to happen within 2 to 4 minutes without oxygen. After 10 minutes without oxygen, that person isn't coming back. And if they do, if they are revived, they're going to be in a vegetative state. With where I work, it's a very rural area, and sometimes even a response of 10 minutes can be challenging. Sometimes if I'm responding to a scene, to an overdose from, another hospital, I may be 30 minutes out. So someone laying there, not breathing for 30 minutes, probably isn't going to recover. That just is what it is. The idea of having Narcan for these families and having it in the home and having access to it is to hope that the layperson can administer this Narcan and restore breathing after an overdose to hopefully improve patient outcome and reduce the number of fatal overdoses that we're seeing in our communities every day. So Narcan is something that I'm a huge fan of. We also provide Narcan to our patients here at Detox when they are discharged. We train them so that they can tell a family member how to give it to them if they need to. So I'm a huge fan of Narcan. Another method of harm reduction is also the more controversial needle exchange programs. And so kind of how this works is people can kind of come and they can exchange their dirty needles for clean ones. And this is mainly just to prevent the spread of things like hepatitis and HIV and other diseases and things like that. With some of these needle exchange programs, I know that there's a lot of pushback from the communities that they're in. I do know with these programs, when people are being supplied clean needles, they're also being given, information on rehab, information on safe use, information on peer support and things like that to help them recover. And it kind of works as planting a seed. So if you look at the needle exchange program as a way of sort of almost as bait in a way, where people can be drawn to a place to get clean supplies, but they're also going to leave with extra information when they go. So there's a lot of pushback, I think, from the harm reduction model. It's something I'm personally a fan of, but I know that classically the idea of drug treatment tends to operate off of the abstinence only model. And that means that, you leave rehab and you're clean forever and that's it. But the truth is that that's not what always happens. So the idea of harm reduction is just, educating people in a safer way to engage in substance use if that's what they choose to do. And just from a, financial and stakeholder standpoint, if you take a project like the Narcan initiative, if Narcan is given in the community and it is administered by a family member before EMS arrives, there's a good chance that, the patient's going to wake up and they don't want to go to the hospital. So from a financial standpoint, this is going to kind of translate to a reduction in ER admissions, a reduction in, the resources that are typically taken up for an overdose. If somebody's not breathing and they're brought to the hospital, you're looking at an entire respiratory team that's going to be called for this person. Depending on the nature of the overdose, this is somebody that may even go on dialysis. This is somebody, that could maybe end up on a vent or in the ICU. And this gets to be pretty expensive. So if we can boost the education on harm reduction in addition to providing people support for sobriety, I think we're going to see this to be an all-around cost-effective approach to addiction.